Hi, Dr. Osborne with Web Wellness University. Last time we talked about statins and how statins block cholesterol. It's a drug that we use, doctors will prescribe to lower cholesterol to reduce the risk of heart disease. And so last time we talked about how statins can cause a CoQ10 deficiency and then subsequently lead to other forms of heart disease. In this video, I want to talk a little bit more in depth about cholesterol and just the whole concept of lowering cholesterol. So the goal here is that if we lower cholesterol, theoretically that we reduce our risk of heart disease. But what you need to be aware of is that the original research that was done on cholesterol was really kind of iffy research. In essence, what was concluded is that 50% of patients that have high cholesterol have an issue with stroke and heart attack, and 50% of patients that have an issue with high cholesterol don't have a stroke or heart attack. So in essence, it was a flip of a coin. In other words, your odds of developing heart disease or stroke as a result of having cholesterol was 50-50, which kind of puts a kink in the whole theory that elevated cholesterol contributes to an increased risk for cardiovascular disease. But let's look at some of the facts about cholesterol. The first fact that we know about cholesterol is that your body makes cholesterol, one, to help carry nutrients. So cholesterol is not just this evil molecule that floats around in the blood and does damage to the blood vessels. Cholesterol is a carrier for vitamins. And specifically, it helps to carry fat-soluble vitamins. Vitamins like vitamin D and vitamin E and vitamin A and vitamin K. So it helps carry these nutrients through the bloodstream, and it helps deliver these nutrients to your tissue. So that's one of the benefits of actually having cholesterol. Second benefit of cholesterol, and actually a Nobel Prize in Medicine was given to cholesterol with this discovery about 10 years ago. Cholesterol is a substance necessary to form brain synapses. So what does that mean? Brain synapses, or neuronal synapses, are these little gaps between your cells in your brain that allow your brain cells to communicate. So cholesterol is very important for your brain to form these synapses, and so a lot of times when we get cholesterol too low, what ends up happening is one of the side effects of statin drugs when we get cholesterol too low is poor memory, lack of focus, mental lethargy, brain fog. Those are some of the symptoms. Again, cholesterol is important for forming brain synapses. Number 3, cholesterol makes all of this different sex steroids. Now, you've probably seen the commercials here lately, especially men, on testosterone. There's a lot of different medical clinics opening up that are experts in hormones, and so what they're trying to do is give men testosterone or increase men's testosterone so that they don't have a number of the different problems associated with that, like low libido, etc. Cholesterol makes your sex steroids. So for women that would be estrogen and progesterone, and for men that would be testosterone. So when we have cholesterol being blocked, and a lot of cardiologists go really super aggressive on lowering cholesterol. The number is it's supposed to be below 200. That's your total cholesterol. But in actuality, those values, those numbers that are recommended are based on a group of doctors getting together saying this is what it should be, but they're saying this is what it should be, and they're being paid by the same companies that create these types of drugs. So Merck and Pfizer and some of these other companies that produce statin medications actually have these doctors on the payroll, and these doctors are the ones who lowered the original value was cholesterol was 250, then it went down to 220, and now the recommendation is 200. And now they've even gone so bold as to say 8-year-olds need to be on statin medications to lower cholesterol. So you can see that, proverbially speaking, the fox is in the hen house. We have to take those recommendations with a grain of salt. Because if doctors are on the payroll for the companies that are basically stand to make a profit over it, then we have to say, is 200 really an accurate number? Is 200 really a dangerous number? So what we have here again is we have statins blocking cholesterol. Cholesterol is important to carry nutrients through the body. It's important to form brain synapses. It's important to make sex steroids like testosterone, estrogen, and progesterone. So is it really something that we